Hello guys, welcome back to another vlog. For those who don't know me, I'm an FMGE from Tver State Medical University, Russia, and I'm currently pursuing my anesthesia residency. After back-to-back weekend 24-hour duties, today, thanks to Mahashivratri, I finally got a day to myself to unpack, wash my clothes, and take rest and catch up with my studies. So since morning today, I've been trying to have fruits, and I of course worship Lord Shiva. I put the water, jal चढ़ाया मैंने शिव जी पे मंदिर में जाके, and I came back, and then I was studying a little bit from this YouTube channel called ICU Advantage, which is very good for ICU notes, ACLS protocol, managing the hemodynamics, fluids, etc. And right now I'm going to the college to punch, and on my way back I'm hoping to catch up with a few friends for grabbing a cup of coffee maybe, and it will also be snack time in my hostel soon. So today I'll be relying on the cups of teas and coffees that I get, as many of them. So usually in the evening I try to make notes based on the topics that's ongoing in the OTs during discussions. The next morning I had to rush to college and quickly get changed into my scrubs. This particular day I was posted in the surgery OT where a lap cholecystectomy, laparoscopic cholecystectomy case was going to happen, so I had to have my workstation ready. I got my morning cup of tea and I'm going to get ready, and then I'll go for my regular duty. This day I was posted in ortho OT, which is modular OT. So you can see all the most advanced equipments in this OT. This is Dexmed Etomidin, which is usually used as an additive in cases of spinal anesthesia. This particular day, I was in charge of monitoring the patient's vitals, and when the operation got over, the patient's BP suddenly crashed when we were almost ready to wheel him out. This happened because he was a known case of low ejection fraction at 45%. We immediately rushed fluids and gave the patient MEF. His heart rate and the ECG and SpO2 were also showing derangements, so we managed the PVC, or the premature ventricular contractions, by Loxicard IV injection, and we gave him full oxygen flow through the mask, after which his condition stabilized and we kept monitoring his vitals. After an eventful week, I decided to spend the weekend in a temple in the heart of Delhi. This is a Bengali Kali Mata temple located in Safdarjung enclave in South Delhi, and this place is so serene and calm, and you get homely feelings when you stay here or visit the temple to worship the goddess. ओके गाइस, तो ये है संडे के स्नैक्स में चाय और चाउमीन. Hi guys, I just got back from the duty and now I'm planning to hit the gym. This particular day I was working at the gynae OT, and my first job is to get the workstation ready by checking the laryngoscope. There has to be a few sizes, and I have to see that they are in functional condition. These are different sizes of Google Airways and LMAs. Then I have to check whether the Bales circuit is patent or functional. This is how we check the Bales circuit by the Petit's test. This is the adjustable pressure valve, APL valve, adjustable pressure limiting valve. So we have to open it or close it by rotating it clockwise or anti-clockwise. Perks of working in anesthesia: you get to check your own vitals.
Guys, I'm back with another 24 hours duty. So today from the morning, since morning, we didn't have any OT as per se because I was posted in a case of adenoidectomy, and the child happened to have wheeze in the chest and upper respiratory tract infection. So basically the case got cancelled because of the upper respiratory tract infection, but we also had another orthopedics case going on in which my colleagues were posted, so that happened, and that was followed by some post-op monitoring, and right now I'll have to attend casualty calls, and if any emergency LSCS happens to be there, then I had to attend that. I changed into my normal clothes and I just got back from the hostel after having my evening tea and snacks. For snacks I had a sandwich, and we keep scrubbing in and scrubbing out whenever we have to go out to have snacks or just roam around in other departments in the hospital. Guys, this is a PAC sheet. We fill this in and do a quick check on the entire body to see if the person is fit for anesthesia or not. Guys, so this is a PAC sheet. Here you will have to fill the patient's details and vitals, and then we will do system-wise questionnaire. For the respiratory system, we will start by asking the patient if he has any ongoing respiratory infection like cough, cold, sore throat, and if he has any known history of asthma, or if he is a smoker. Now, if he is a smoker, then he will fall under ASA grade 2. Also, if a female patient is pregnant, she will be considered as ASA grade 2. And for females, it is mandatory to check the last menstrual period. Then we will do a test called the breath holding test, which we will add in this square box in the respiratory section. Then we will move on to the cardiovascular system, where we'll check if the patient has hypertension, if the patient takes any medicine for hypertension, or any other diseases like myasthenia gravis. Then we'll check the heart sounds. We will inspect and auscultate the chest. Then we will move on to central nervous system, where we will check the patient's orientation. We will ask for any history of loss of consciousness, trauma to the head, and seizure disorder. Then we'll move on to the endocrine system, where we'll ask the patient if he has high blood sugar or does he take medicine for thyroid. Then we'll move on to the airway examination, where we'll request the patient to open his mouth and do the Malampati grading based on whether or not the soft palate is visible, and if visible, then how much part of it is visible. We will do the neck movement test. We will ask the patient about dentition, if he has any tooth removed. If the patient is edentulous, then also we have to mention that. If there is any teeth that is shaking or is breakable, we have to ask about it as well. Then we will move on to the spine examination, where we'll inspect the local area, the space between the spines, between the vertebrae. We will measure the Tver's line from the anterior superior iliac spine and check the space between L3 and L4 if there is any anatomical distortion or any scar there. Then we'll move on to any other disorder of the kidney or coagulation disorder, any history of addiction, any family history. And also we will mention all the medicines that a patient is currently taking. After this, we will ask the patient if he has any allergy. Then we'll move on to the next page after planning the anesthesia, where we will note down all these reports. So these are the investigation that have to be done before any surgery: hemoglobin, total leukocyte count, platelet, PT-INR, urea creatinine, sodium, potassium, sugar, HbA1c, TSH,
serum bilirubin, SGOT-PT, alkaline phosphatase, triple H, chest X-ray, ECG, echo, and PFT. And thereby we will put any advice if required, and we will give or not give allowance for surgery. The file where it starts with consent, and then we'll do the pre-operative checklist, surgical safety checklist, then vitals monitoring, intraoperative monitoring. Here we have to mention the injections that we give. Here we have to do every 15 minutes we have to take down the vitals. Here we have to mention how many fluid bottles have been used, how much blood has been lost, how much was the urine output, how many blood has been transfused, then the technique of anesthesia, if it's a general procedure or a regional anesthesia, and what all we were monitoring during the anesthesia. If there is any adverse effect, then we have to mention that as well. Then we'll move on to post-operative care, where we'll monitor the vitals, mention the speed with which we will deliver the oxygen, and other relevant instructions. This is mainly what we have to fill in the OT file. Guys, I just got a message from ortho department that I have to do a pre-anesthetic checkup for a patient, bedside pre-anesthetic checkup, for which I contacted my senior, and now I'll be heading off for that. For this video, guys, see you in the next one, and I will fill you in on what happened next in my 24 hours duty in my next video. If you like watching vlogs like this about my anesthesia residency, then do like, share and subscribe, and wait for the next one.